want to welcome everyone out to the Health Department on today. My name is Dwayne Holder, and for those that don't know, I have the privilege of serving as your interim health director here at the Health Department. We want to thank everyone for coming out today. You know, a year ago during our budget season, the county had to unfortunately make some unpopular decisions and some tough decisions based on the budget challenges that we had. Among those were a decision to cease adult primary care services and dental services here at the Health Department. We are ecstatic that as a result of a public-private partnership between Cumberland County Public Health and Stedman-Wade Health Services, that effective today, we will have full-time, Monday through Friday, adult primary care services here at the Health Department. Again, this is thanks to a grant from the state of North Carolina's Office of Rural Health. We've been able to foster this partnership since back in the fall of 2017. However, that was on a limited basis. As many of you know, adult primary care is a much needed service in our community, and we are pleased to have this partnership. Having the adult health clinic here allows our patients access to a one-stop shop for receiving many of their needed services. The Health Department also, as many of you know, has a valuable, very valuable partnership with HealthNet, and I think I saw some representatives from HealthNet here. And together with Stedman-Wade, these partnerships will prove most beneficial for meeting the needs of the underserved, the uninsured, and the underinsured citizens of our county. Again, we want to welcome you out today, and at this time, I would like to bring forward the chairman of the Cumberland County Board of Commissioners, Mr. Larry Lang.
Thank you. Can you believe this guy right here? I mean, he just wears so many hats around here. Thank you so much, and thank you, Mr. Adams, for being here, and Commissioner Charles Evans. And I'm honored to be here today on behalf of our county commissioners. And this is a good day, as Dwayne said, for our public health department and for our citizens. You know, without a sense of caring, there can be no sense of community. And so today we're here to celebrate. And part of that celebration is my two friends right here, and we're so pleased to have Stedman-Wade Services on our team, and we look forward to a great partnership. My friends, we're so much stronger when we work together. And in this case, the people who will benefit the most are those who need public health services the most in our community. Those who have health care have hope. Let me repeat that. Those who have health care have hope. And isn't that what we're all about as a community? Hope for our community. Our community ultimately is only as strong as our health and welfare of our community and the health and welfare of the populations all over this world. Health equity is everybody's business. Health equity is everybody's business. And we feel a strong sense of urgency in Cumberland County to make sure that that's a priority. Having said that, my good friend, Mr. Glenn Adams, would like to come up and take about 35 or 40 minutes and take some. That's right. But seriously, this has been a labor of love for our ex-chairman, and I know that we spent a lot of time talking about this out at the hospital. And so, Glenn, it's always a pleasure. Charles, thank you so much as commissioner, and thank you for our county staff. And Dwayne, thank you for making this possible today. God bless you.
Good afternoon. Or it may still be morning, but let me tell you that today is not a culmination. Today is a beginning. And you heard Mr. Holder talk about when we were in budget season and that we closed that. But that wasn't what it was. It was a vision. It was a vision for something bigger and better than what we ever had. And so that vision was to enhance what we were going to do in these clinics. It was never to take away any kind of health care. I was the chairman back then, it was a tough budget season, we did that. But I will tell you that what I do know is that the Lord puts a ram in the bush all the time. So we were having this discussion about this vision, and I get a phone call from Dr. Carr, Sandra Carr, who's at Stedman-Wade, and she calls me and says, I hear you have a vision about what you want to do at the health department. Remember that telephone call? And together we sat down and we had a discussion about bringing Stedman-Wade in a partnership, a public-private partnership, to be able to enhance the services that we give to this community. And from that, we then brought in Chris Ray, who's now left us. Chris Ray was with HealthNet. And we brought Chris Ray in and talk about HealthNet. Because let me tell you what the vision really is for this. Is that, as we know, there's jail health, there's the health department, and there's Cape Fear Valley. Well, what we're talking about with this partnership is a continuum of care. Folk who go into the jail get serviced by Southern Health, and when they leave, don't have a primary care physician, through HealthNet will be coming to the health department, to Stedman-Wade, to the clinic, and then they will have a continuum of care. Those who leave the emergency room out there will, through HealthNet, again, come through here and get to the health department and have a primary care physician to be able to talk about it. I'm going to tell you that I believe that this is going to be a model for the state of North Carolina and will eventually go throughout this country, because it's because of these kind of partnerships that make it work. And so today, again, I tell you, it's not the end. We're celebrating the opening today, but we're celebrating something much bigger than that. And if all of you all, if we can just all open our minds, get out of our silos, and believe that we're going to take care of each other in this community, that's what this is all about. And so to my partners at Stedman-Wade, I say thank you. To all of you all who work at the health department who buy into this, we tell you thank you. Because see, it can't be done in silos. It can't be done individually. And if we all don't see the vision, if we all don't buy into this, then we've just failed. And I refuse to fail this community. So today, let's celebrate, but let's think about the vision, and let's move on. Thank you so very much.
I'd like to ask Dr. Philbrick if he would come. Dr. Philbrick is the chair of our Board of Health.
And we're very happy to have you all here. I've been dealing with Dr. Carr and her group for a long time as far as doing the eye parts of their diabetic patients. This is a great group. They're strong, and there's no reason why they can't fulfill everything that we want to have happen in this county. And so we're really very proud of this relationship too, and proud of what the county commissioners have done and where we're going with this health department. So we're excited about health in Cumberland County, and you know, we have a large number of physicians here, and we have a large number of lawyers, and we have a large number of lots of people, but sometimes small entities get lost. In fact, maybe more times than we'd like to believe. And not only is it important to treat patients, but it's very important to educate them. Education, especially with diabetes, is a real major problem. They don't understand their disease, and if they don't understand their disease, they more than likely may not follow through on the treatment of the disease. So it's an exciting time, and hopefully everything will go through the way we want it to go through. And thank you all for coming.
Good afternoon. Thank you, Mr. Holder, for the opportunity to represent Stedman-Wade. Mrs. Margaret Covington is away in D.C. lobbying for a community health center, so we're very proud of the work that she's doing today. And I would like to say thank you to the commissioners. Commissioner Glenn, thank you for taking my phone call that day, and it was a really exciting time to think about the opportunities that Stedman-Wade could help deliver services, and I want to thank the entire adult health management team for receiving us and working so closely with us in this partnership, and we look very much forward to restoring the clinic and taking it to its highest potential and then some. In addition to our work with the dental center and bringing it along with us, we're very dedicated to this partnership for now and all of the potential going forward. So thank you all for this opportunity, and we look forward to continue to work with you very closely.
And last but not least, Dr. Burks, if you would have some remarks.
Thank you. Well, for all of you who don't know me, my name is Tamika Burks. I am a family medicine trained physician. I train right here in the city at Southern Regional AHEC. Let's see, I worked for way early on in my career in community medicine, which is a true passion of mine. I had formed great relationships with Margaret Covington, the CEO of Stedman-Wade, and of course my friend and colleague, Dr. Carr. We've been working together for a very long time, and she understands who I am and my passion for community medicine as well. So when the vision came along, I'm so happy that they thought about me to call me and ask me if I would like to collaborate with them on this partnership with the health department at Stedman-Wade Health Services, and I was delighted. I just want to say that I'm happy to be here. I'm so happy that I can be a part of the vision that the health department and Stedman-Wade has established. I hope that I can contribute. My intent is to provide high quality primary health care for those who are most in need, to promote wellness for them so they can contribute to their community as well. So I just thank you all for having me. Anything that I can do to help you, I am open and willing, and I'm just here to have fun and help contribute to the vision. Thank you.
The last thing that I wanted to say is, well, two things. One, Dr. Jeanette Council was to be here. She had a unforeseen event to come up, so she sends her regards. She is also, and she said, she's also a member of the Board of Health, so she sends her regards. And then I said last but not least, but definitely last but not least, and I know Commissioner Adams mentioned it, but I too want to reiterate with the staff of the Health Department. Thank you, thank you, thank you. And since I have come on board as the interim, this staff has been very supportive, and all of the work that has brought this about, I'm standing up here, but I don't deserve any attention. They have done the heavy lifting. They are the ones that have worked with Stedman-Wade to help bring this about. So thank you to all of you as well.